Obesity is a serious chronic disease that affects millions of Americans. 1 in 3 adults struggle with this condition, according to the CDC. This puts them at an increased risk for type 2 diabetes, heart disease, and cancer. While eating a healthy diet and exercising regularly will help, others need medical support. If you're among them, the idea of weight loss surgery may have entered your mind. Hello, everyone. I'm Susie Larry Hall, Enloe's Community Outreach Manager, and today we're here with Dr. Erik Simchuk. Dr. Simchuk is a surgeon and part of Enloe's bariatric program. He has performed countless bariatric procedures and says these surgeries can be life-changing and life-saving. And with that, let's get started. Thank you, Dr. Simchuk, for being here.
No, you're welcome.
Yeah. So my first question is, when is someone considered to be obese?
Well, that is an excellent question and really is in the mind of the beholder. Now, we can define obesity as having a body mass index or a BMI of 30 or above. One gets your body mass index by dividing your weight by your height squared, is really your body surface area. The interesting thing about it is that we, over time as a society, have begun to think of obesity as really the new normal. They've done those studies in which they'll take people in a room and they'll walk people by them. They'll ask them to point out those with a normal weight. And routinely now, people will point out people who are actually obese as having a normal weight status.
So what are some of the health conditions associated with obesity?
Well, there are many, and the list is very long. But more commonly, people will think and know about type 2 diabetes mellitus. Really begins to occur when a person reaches a body mass index of 30. High blood pressure, or what we call hypertension. All the variations of high cholesterol, elevated liver function tests that your primary doctor may say you have a quote-unquote fatty liver is actually the liver being damaged by the excess fat. But you can end up with anatomic problems as well, such as obstructive sleep apnea, stress urinary incontinence, gastroesophageal reflux disease, and the list goes on and on.
So why is it that when you're obese, losing weight can be so hard?
Oh, that is an excellent question. And I think a question that so many of our patients and patients currently and patients in the future, they struggle with on a daily basis is, why can't I do this on my own? I've tried so many diets, I've tried so many exercise programs, and yeah, I can go and lose the 40 or 50 pounds that I wanted to lose, but then over the course of the next year, I gain it all back. Why can't I do this on my own? The reason is biology is not on the patient's side. It's not on the human being's side. Our body defends itself against weight loss through neurological and hormonal mechanisms. Your body doesn't think of weight loss as a good thing because all it knows is that its energy reservoir, which is our fat stores, are going away. All it knows is that the calorie source has grown scarce, the energy reservoir is diminishing, and what does your body think? Your body thinks it's dying because it's not getting the calorie stores that it needs. And so it's going to defend itself in every way it can against that and put the weight right back on. It's that good and it is that difficult to stop. That is where surgery comes in, and that's why surgery is different, because we remove the neurological and hormonal defense mechanisms against weight loss.
So what types of bariatric surgeries are performed at Enloe?
The majority of what we do currently is called the sleeve gastrectomy, or originally referred to as the vertical sleeve gastrectomy. We still do an operation called the Roux-en-Y gastric bypass, although the sleeve gastrectomy really has taken the world by storm after it began to be approved by insurance companies in 2010. We do all of our operations laparoscopically, which is working through little incisions, most of which are really just 5 millimeters, which is about the width of a pencil. The vast majority of our patients stay one night only with us in the hospital now and are able to go home the next day.
That's amazing. So Dr. Simchuk, a common misconception is that people have to pay for this bariatric surgery out of their pocket, but that's not the case. Can you tell us more?
Oh, yes, Susie, that's an excellent question. I think you're right. I mean, it is a very common misconception. People think that that weight loss surgery, whether it's the sleeve gastrectomy or the Roux-en-Y gastric bypass, these are what we call aesthetic surgeries or elective surgeries, when in fact, you might even consider these surgeries urgent or emergent when it comes to many of our patients who, because of all of their medical conditions related to the weight, their life may be, shortened quite a bit. So no, the medical insurance companies have covered these operations for years. It actually is uncommon now to find a patient with an insurance plan that doesn't cover weight loss surgery. So the out-of-pocket for, beginning to end is minimal to none for most of our patients now.
Oh, that's amazing.
Right.
Yeah. Would you say that most people who have bariatric surgery end up getting back to their ideal weight?
In regard to the term ideal body weight, it's actually a term it's a term that's defined by insurance companies. And insurance companies look at life table analyses and determine that a person at their ideal body weight just tends to live longer. So it actually might surprise you to find out that ideal body weight for a person of any height, you might think of them as really skinny, somewhat unhealthily skinny. So our goal is obviously not to get a person to their quote-unquote ideal body weight. What we want to do is get them into a normal weight category, which gives them a body mass index of around 25.
Can you tell us about the support services?
Yeah, so we are a center of excellence with the American College of Surgeons and the American Society of Metabolic and Bariatric Surgery. And as a center of excellence, we provide a tremendous amount of preoperative and postoperative education and support services. Most of our patients undergo 4 months of preoperative, that's before surgery, educational classwork, learning about nutrition, learning about diet, learning about exercise, programs, etc.
So what does it look like life after bariatric surgery? What does that look like for patients?
I can tell you that the life is beautiful. It's a very gratifying thing that I do. That part of my surgical practice is bariatric surgery. Because really when you say what does life look like, really we're giving them a life back. In that 1 year out from surgery, their body really isn't deciding for them what they can and cannot do in their life, such as walk again, even farther than 250 yards, go hiking, go biking, go to the amusement park and actually get on a ride and ride that ride with their family instead of being the one that has to sit on the bench and watch everybody else have fun. It's really all about re-engaging in life and being able to partake in those things that they couldn't before surgery.
Thank you for being here, Dr. Simchuk, and thank you all for joining us. We hope you found this information helpful. If you're interested in bariatric surgery or just want to know more, visit www.enloe.org/wait. Take care.